Have you ever walked out of a doctor's office with more questions than answers, clutching a handful of test orders that made your heart race faster than a morning jog? You're not alone in feeling this way. In fact, what I'm about to share might surprise you, and it's something your doctor probably won't tell you during your next visit. Every year, millions of seniors line up for health checkups, believing they're doing everything right to stay healthy and safe. But here's a hidden truth that's been quietly buried in medical journals. Some of those routine tests, the ones your doctor says you absolutely need, could actually be pushing you toward unnecessary surgery, dangerous complications, or treatments that do more harm than good. Recent studies reveal something quite shocking. Up to 37% of medical tests performed on seniors lead to unnecessary treatments, complications, or lifelong side effects. Even more concerning, research shows that 99% of people over 70 have no idea they're being over-tested. One particular test that we'll discuss today actually causes 5% of all cancer cases in the United States. That's equal to the number of cancers caused by drinking alcohol daily. Now, I know this might sound alarming, especially when we've spent our entire lives believing that more medical care equals better health. But the truth is, medicine isn't one size fits all. And what makes perfect sense for someone in their 50s might not be the wisest choice for someone who's lived 7 beautiful decades or more.
I want you to think of this conversation as sitting down with a trusted friend who's done the homework and wants to share what they've learned. Someone who understands that your peace of mind matters, your comfort should never be compromised, and your time is precious. Today, we're going to talk about 5 specific health checkups that many doctors still routinely recommend after 70, but that science shows might actually cause more worry, expense, and even physical harm than benefit. Let's start with something that might catch you off guard: those routine bone density scans. You know, the DEXA scan that sounds so harmless and straightforward. Just lie down, a machine passes over you, no pain, no needles, and you walk out knowing whether your bones are at risk for fractures. It seems like such a smart, preventative step, doesn't it? But here's what happens in the real world that nobody talks about. Past the age of 70, a bone density scan often creates more fear than actual benefit. The results almost always come back showing lower density, even when there's no real danger lurking. That's because bone loss is as natural a part of aging as those laugh lines around your eyes or the silver threads in your hair. It happens to everyone. Yet here's where it gets troubling. Many seniors are immediately pushed into taking medications like bisphosphonates, which are supposed to strengthen bones, but come with some serious side effects. I'm talking about jaw necrosis, a rare but frightening condition where the jawbone actually starts to die, and severe esophageal irritation that can make swallowing painful.
Now, here's the part that really matters. A comprehensive study published in the Journal of the American Geriatric Society followed over 1,200 women over 70 and found that bisphosphonates reduced fracture risk by only 0.3% after 5 years. That's not nothing, but it's hardly life-changing. Meanwhile, those same women were far more likely to suffer from medication side effects, including digestive issues, inflammation in the esophagus, and something called atypical fractures, brittle bones that break in odd, unexpected ways. Let me tell you about Rose, a 76-year-old retired piano teacher who came to see me after what should have been a routine checkup. She had never had a fall, experienced no bone pain, and walked daily around her neighborhood, chatting with neighbors and tending to her garden. Her DEXA scan came back showing osteopenia, which is simply a mild reduction in bone density that doesn't even qualify as osteoporosis. Her doctor immediately started her on alendronate, a bisphosphonate medication. 3 months later, Rose was experiencing severe reflux that woke her up at night and jaw pain that made eating difficult. By the time she found her way to my office, she hadn't played piano in weeks, something that had brought her joy for over 60 years.
We took her off the medication and started her on what I call the natural approach: vitamin D supplementation, weight-bearing exercises like resistance bands that she could do while watching her favorite shows, and a calcium-rich diet filled with foods like sardines and leafy greens. A year later, Rose was back to performing recitals at the local community center with stronger legs, better balance, and 0 fractures.
According to a 2022 study published in Osteoporosis International, strength training, balance exercises, proper nutrition, and treating vitamin D deficiency have been shown to reduce fractures by over 20%. That's real prevention that doesn't come with a list of scary side effects. The second test that deserves a much closer look is something that affects our minds and hearts in ways we don't always expect: brain MRIs for memory concerns. When you start feeling more forgetful or confused, the natural response is fear. Fear of dementia, fear of Alzheimer's, fear of losing yourself. So doctors often respond by ordering a brain MRI, thinking they're being thorough and caring. But here's the uncomfortable truth that rarely gets discussed. MRIs in people over 70 usually show age-related changes that are completely normal. Slight shrinkage, white matter spots. These are simply signs that your brain has been working hard for 7 decades or more. But once those spots are seen on a scan, they can trigger a cascade of fear, more tests, and sometimes even procedures that won't improve your memory and might actually make things worse. In 2021, a revealing study published in Neurology Today reviewed over 3,000 MRI scans in patients aged 70 to 85 who had mild cognitive complaints. Here's what they found. 86% showed some form of brain abnormality, but only 3% of those findings were actually linked to a treatable condition. That means 97% of people went through the emotional devastation of hearing there's something wrong with your brain, when really there wasn't anything wrong at all.
This is where the story gets even more concerning. Nearly 12% of those patients were sent for invasive procedures like spinal taps or exploratory biopsies, all based on vague scan results that turned out to be meaningless. Can you imagine the anxiety, the sleepless nights, the way that kind of news changes how you see yourself in your future? The truth is, unless you're experiencing severe neurological symptoms like seizures, sudden personality changes, or rapid functional decline, an MRI is rarely helpful for mild memory concerns. A better first step is a simple cognitive screening test, a paper-based exam that evaluates memory, attention, and problem-solving skills. It's inexpensive, effective, and avoids the risk of unnecessary panic that can rob you of months of peaceful living. As we continue exploring these important topics, remember that knowledge is power, and you have every right to ask questions about any test or procedure recommended to you. Your healthcare should serve your well-being, not create more worry in your life.
Now, let me share something that might really surprise you. The third test on our list is probably one you've had multiple times without giving it much thought. It's the cardiac stress test, and it's become almost routine for anyone over 70 who mentions feeling a bit more tired than usual or having occasional chest tightness. Picture this. You're at your regular checkup, and you mention to your doctor that you've been feeling a little winded when you climb stairs, or maybe your chest feels tight sometimes when you're hurrying to catch the bus. Your doctor's eyes light up with concern, and before you know it, you're scheduled for a cardiac stress test. It seems like good, thorough medical care, doesn't it? But here's what they don't tell you about stress tests after 70. They often create more problems than they solve, especially when they're done on people who don't have clear signs of heart disease. The test itself involves either walking on a treadmill while connected to heart monitors, or, if you can't exercise, being given medication that simulates the stress of exercise on your heart. The trouble is in the accuracy,
And this is where the numbers become quite eye-opening. Studies show that in adults over 70, the false positive rate for stress tests can be as high as 40%. That means almost half the time the test says there's a problem when there really isn't one. But once that alarm bell rings, it's hard to turn it off. Those false alarms lead to follow-up tests like angiograms, where they thread a catheter through your blood vessels to your heart, and sometimes even unnecessary stent placements or bypass surgery. In 2017, a major study published in JAMA Cardiology found something quite disturbing. More than half of all stents placed after stress test referrals were done in patients who had no real symptoms or benefit from the procedure.
Let me tell you about Raymond, a 75-year-old retired postman who stayed active by walking his dog every morning and tending to his vegetable garden. During a routine checkup, he mentioned to his doctor that he sometimes felt tired when walking up the hill to his mailbox. His doctor, wanting to be thorough, scheduled a stress test, just to be sure. The results came back unclear, not definitively normal, but not clearly abnormal either. So Raymond was sent for a cardiac catheterization, where they insert a thin tube into the arteries around the heart to check for blockages. They found a mild narrowing in one artery and placed a stent, thinking they were preventing a future heart attack. But that night, Raymond had a reaction to the contrast dye they used during the procedure. His kidneys, which had been working just fine for 75 years, suddenly started struggling. He spent 6 days in the hospital, needed weeks of follow-up care, and had to limit his fluid intake for months. The irony? The fatigue he'd been experiencing never changed because it wasn't a heart problem to begin with. He was simply an older gentleman who needed better hydration and perhaps a bit more rest between his daily activities. Here's what research tells us. If you're over 70 and not experiencing classic cardiac symptoms like chest pain during activity, significant shortness of breath during light exercise, or a dramatic drop in your energy levels, then a stress test may do more harm than good. A 2019 analysis found that for every 1,000 stress tests performed in low-risk seniors, only about 12 actually prevented a heart attack, while over 200 led to unnecessary procedures with their own risks.
A better approach is often a simple resting EKG, which looks at your heart's rhythm while you're comfortable and still, or even a coronary calcium scan, which uses low-dose radiation to show whether dangerous plaque is building up in your arteries. These tests are safer, simpler, and far less likely to push you into a procedure you never needed. Now, let's talk about something that might make you shift uncomfortably in your seat: colonoscopies. You probably didn't expect this one to make our list, and I can already hear some of you thinking, but isn't colon cancer screening always important? It's a fair question, and it goes against everything we've been told for decades about prevention. But here's the reality. Colonoscopy is not always a wise choice after age 70, and it's almost never recommended after 75 unless you're experiencing specific symptoms like bleeding, significant changes in bowel habits, or unexplained weight loss. The risks of the procedure itself go up significantly with age, and the benefits start to diminish. Let's talk about what that preparation process really means for an older adult. Those strong laxatives aren't just unpleasant, they can cause serious dehydration, dangerous drops in blood pressure, dizziness that leads to falls, and even kidney problems. The sedation used during the procedure poses additional risks to brain function in older adults, and the procedure itself can cause complications like bleeding, tears in the colon wall, or even heart rhythm disturbances.
The numbers here are quite sobering. A 2019 study published in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older. They found that for every 1,000 colonoscopies performed in patients over 75, only 2 lives were saved from colon cancer. But here's the kicker.
over 20 people in that same group experienced serious complications from the procedure itself. That's a 10-to-1 risk-to-benefit ratio that would make most people think twice. Even when polyps are found during these procedures, many of them are small and slow-growing. In an older adult, removing them can sometimes do more harm than simply leaving them alone to live their quiet, harmless lives in your colon. This happened to Dana, a vibrant 73-year-old grandmother who ran a small bakery with her daughter. She had no symptoms, no bleeding, no changes in her bowel habits, no family history of colon cancer. She felt wonderful and was proud of her regular, healthy digestion. But her new primary care doctor, fresh out of medical training and eager to follow all the guidelines, strongly urged her to get a screening colonoscopy. Dana, being a responsible person who trusted her doctor, agreed to the procedure. During the colonoscopy, a small, benign polyp was removed and she was sent home with instructions to take it easy for the rest of the day. But that night, she woke up with intense abdominal pain and fainted in her bathroom. Her daughter rushed her to the emergency room where they discovered a bowel perforation, a tear in the colon wall that had occurred during the polyp removal.
Dana spent 9 days in the hospital, lost 10 pounds during her recovery, and hasn't felt quite the same since. The bakery had to close temporarily, and she still experiences digestive issues months later. When we reviewed her case, we discovered she had already had 2 clean colonoscopies in the past decade. There was absolutely no medical reason to repeat the procedure. The U.S. Preventative Services Task Force, which sets the gold standard for screening recommendations, currently advises stopping routine colon cancer screening at age 75 for most people. For those in excellent health who really want some form of screening, a stool-based test like the FIT test is often a much safer option. You can do it at home, there's no preparation involved, no sedation required, and it still catches most concerning cases that need attention. The key is asking your doctor about alternatives and understanding that once you're caught in what I call the colonoscopy pipeline, it can be very difficult to step off that conveyor belt of repeated procedures. These decisions about your health should never be made lightly, and they should always take into account your individual situation, your other health conditions, and most importantly, what matters most to you in terms of your quality of life and peace of mind.
Now we've reached the most concerning test on our list, and I want you to pay close attention to this one because it's being marketed heavily to seniors as the ultimate in preventative care. I'm talking about full-body CT scans, those comprehensive imaging tests that promise to catch problems before they become serious. You've probably seen the advertisements. Maybe they came in your mail, or you heard about them from a friend who went to one of those executive health centers or concierge medical practices. They're marketed as the gold standard of prevention, promising to scan your entire body and catch cancer in its earliest stages. It sounds like the smart, responsible thing to do, doesn't it? After all, if we can catch problems early, we can fix them before they become life-threatening. But here's the shocking truth that the marketing materials don't mention. These full-body scans expose your body to an enormous dose of ionizing radiation. We're talking about 10 to 20 millisieverts per scan. That's equivalent to about 500 chest x-rays all at once. And for older adults, especially those over 70, the risk of triggering unnecessary follow-ups, biopsies, and even surgeries is incredibly high. Here's the part that should make your blood run cold. According to a 2023 modeling study published in JAMA Internal Medicine, the dramatic rise in CT scans across the United States may now be responsible for up to 5% of all cancers in our country. That means 1 out of every 20 cancers could be caused by a scan that was supposed to prevent disease. Think about that for a moment. The very test that promises to protect you from cancer might actually be giving you cancer.
The irony is both tragic and infuriating. There is zero scientific evidence that full-body CT scans without symptoms actually save lives. None. What they do extraordinarily well is detect harmless nodules, calcifications, and cysts that are simply part of the natural aging process. But the moment these completely normal findings appear on a scan, they set off alarm bells that can echo through your life for months or even years. Let me tell you about Marcus, an active 80-year-old who had been teaching martial arts to other seniors at the community center for over a decade. He felt fantastic, better than many people half his age. His energy was good, his appetite was healthy, and he was living life to the fullest. But when his daughter suggested he treat himself to a comprehensive health evaluation at an upscale medical center, Marcus thought it sounded like a wonderful gift to himself. The full-body scan showed a tiny 3-millimeter lung nodule, something so small it was barely visible. But that minuscule spot set off a chain reaction that would change Marcus's life. He was immediately referred to an oncologist, which terrified him. The oncologist ordered a PET scan, which uses radioactive sugar to highlight potentially cancerous areas. When that test came back inconclusive, they recommended a needle biopsy to get a definitive answer. Marcus, who had been sleeping peacefully and enjoying his daily activities just weeks before, was now consumed with worry. The biopsy showed that the nodule was completely benign, just a tiny scar from some long-forgotten respiratory infection. But during the biopsy procedure, the needle accidentally punctured his lung, causing it to partially collapse. He spent a week in the hospital, endured 2 months of painful recovery, and never quite regained his full confidence in his body.
All of this suffering, all of this fear, all of this medical expense for something that could have been left alone to live quietly and harmlessly in his lung for the rest of his natural life. The American College of Radiology, which represents the doctors who actually perform these scans, is crystal clear about this. There is no proven benefit to full-body CT scanning in healthy adults, and there is significant potential for harm. The risk-to-benefit ratio is so poor that most legitimate medical organizations actively discourage these scans. If you're experiencing specific symptoms, unexplained weight loss, persistent cough, visible lumps or swelling, or other concerning changes in your body, then targeted imaging absolutely makes sense. But scanning your entire body with no particular concern in mind is like searching for treasure with a metal detector in a minefield. You might find something interesting, but the explosion could be far worse than anything you were trying to avoid. The safer, smarter approach is something our grandparents understood instinctively. Listen to your body. If you feel well, if you're maintaining your regular activities, if you're sleeping peacefully and enjoying your meals, then trust that wisdom. Regular checkups with a primary care doctor who knows you and your health history are far more valuable than any high-tech scan that views your body as a collection of potential problems rather than the remarkable resilient system it's been for 7 decades or more.
So there you have it. 5 health checkups that may seem helpful, but can actually cause more harm than good once you've reached this wonderful stage of life. We've talked about bone density scans that can lead to unnecessary medications with serious side effects, brain MRIs that create panic over normal aging changes, cardiac stress tests that trigger cascades of invasive procedures, colonoscopies that carry significant risks for minimal benefit, and full-body CT scans that might actually cause the very diseases they claim to prevent. Modern medicine is truly miraculous in many ways, but it's not perfect, and more is not always better. Sometimes the wisest choice is to step back, take a breath,
And remember that your body has carried you through 7 decades of life with remarkable grace and resilience. It deserves care that honors that journey, not tests that treat it like a machine in need of constant inspection. The most important thing I want you to take away from our conversation today is this: you have the right to ask questions. When your doctor recommends a test, ask what happens next if something is found. Ask about the risks of the test itself. Ask whether the results would actually change your treatment or improve your quality of life. If the answers are unclear, or if the risks seem to outweigh the potential benefits, it's perfectly reasonable to say no. Real prevention, the kind that actually improves your life, starts with the basics that you already know in your heart. Stay as active as your body allows. Eat foods that nourish you and bring you joy. Get enough sleep to feel rested. Maintain the relationships that matter to you. Choose your medical care carefully, and don't let fear drive you into tests and treatments that might rob you of the very peace and well-being you're trying to protect.
Your time on this earth is precious, and you've earned the right to spend it feeling confident about your health choices rather than anxious about every test result. You've lived long enough to know that some things are worth worrying about and some things simply aren't. Trust that wisdom. It served you well for 7 decades, and it will continue to serve you well now. I'd love to hear about your experiences with medical testing. Have you ever had a test that caused more worry than it was worth? Have you learned to ask the right questions before agreeing to procedures? Your stories and insights could help other people navigate these decisions with more confidence and peace of mind. Share your thoughts in the comments below. I read every single one, and your experiences matter more than you might realize. Remember, you're never too old to make today better than yesterday. You're never too old to choose hope over fear, wisdom over worry, and quality of life over quantity of tests. Let's keep supporting each other on this journey, because the best medicine of all is knowing that you're not alone. You're never too old to make today better than yesterday. Let's keep going together.